This presentation will discuss traditional Chinese medicine.
The traditional Chinese medicine, or TCM, is a unique approach to health that use mind and body practice, such as acupuncture, Tai Chi, and herbal products to tackle health problems. The practice originated in China thousands of years ago and has remained relatively constant over the centuries. TCM practitioners use herbs, acupuncture, diet, cupping, and Qigong for prevention and treatment of health problems. Many of the Chinese medical facility practice TCM alongside with modern medicine today. TCM is considered as a form of alternative medicine. So, Taoism philosophy is basically it's a traditional Chinese belief humans to be a part of the surrounding universe and interconnect with nature and is subject to its force. Health is a state where an individual attains a balance between the internal body, organs, and the external elements of earth, fire, wood, water, and metal. Um, so, the philosophy of Taoism considers that organs in the body provide a mutual support to each other. For a person to be healthy, there must be a balance in all the organs and their functions. The balance is achieved in a part by the harmony of yin or passive and yang active. Two opposite but complementary energies believed to affect all life. Another theory in TCM is that QI or Chai, life force or a vital breath, flows all over the body via mediums or specific pathways. The theory the theory suggests that disease and other physical, mental, emotional health problems are a result of a blockage, weakness, or excess in the flow of QI. So balancing yin and yang restores the flow of QI or achieving wellness.
So I had interesting cures and treatments. So I just picked 3 Chinese practices and then I explained the cures and treatments. So the first one is acupuncture. It's a technique in which specific points on the body are stimulated by inserting the needles. And then some studies suggest that acupuncture stimulates the release of the body's natural painkillers and affects areas in the brain involved in processing pain. It could also help ease types of pain that are often chronic, such as low back pain, neck pain or knee pain, or carpal tunnel syndrome. It may also help reduce the frequency of tension headaches and prevent migraine headaches. And then Tai Chi, which is the second Chinese practice, combines certain postures, gentle movements, and mental focus, breathing, and relaxation. Some findings suggest that practicing Tai Chi may improve balance and stability in older people and those who have Parkinson's disease. It can help reduce pain from knee osteoarthritis, help people cope with fibromyalgia and back pain, and promote quality of life and improved mood in people with heart failure. The third Chinese practice is a type of Chinese massage. It consists of placing several glass or plastic cups on the body, and the goal is to release any obstruction and toxins that trapped at the surface of the skin.
The advantages of traditional Chinese medicine is also called TCM. TCM can do a conglomerate of different helpful things that aids in the benefit of the patient, such as reducing inflammation, improving quality of sleep, protecting cognitive health, and also has very few side effects when compared to the Western pharmacological medicines and interventions. So to start off with inflammation, TCM helps reduce inflammation through herbal treatments, acupuncture, acupressure, also through Tai Chi, and the other methods that TCM is considered, such as cupping. It also helps counteract ongoing inflammation in the body that has already been precipitated. TCM can help reduce that. It also helps to improve the quality of sleep, which is really good. And TCM helps improve quality of sleep through improving blood circulation and calming anxiety and improving your cognitive strength to help you sleep better. There are many other health benefits of TCM, and it is used to address conditions such as back pain, depression, anxiety, insomnia, obesity, fertility issues, allergies, and high blood pressure. So you can see with the insomnia and the anxiety how the TCM can help to alleviate both, especially when comparison to the Western medicines that typically have insomnia or anxiety or hypersomnia as the common side effects. Since we're talking about side effects, I'll go ahead and mention that TCM has very few side effects when compared to the Western pharmacological interventions, and that's really good because often when you take the typical Western medicine, they have very tedious or unwanted side effects, or they counteract with a lot of different other medications that the patient has to be mindful when taking, and they can cause adverse reactions and toxicity, and these are inevitable effects that can be bothersome to the patient. So that's why a lot of patients don't remain compliant or adherent to their medication regime, because of those side effects that often counteract the mechanism of action of what the medicine is trying to do in the first place. So often that's why patients will revert to using the homeopathic or the traditional Chinese medicines instead. And lastly, TCM helps to protect cognitive health. Herbal medicine using TCM helps to reduce stress and regulates hormones in the brain and assists in controlling the immune response of the body. As a result, the Chinese herbs can decrease the risk of developing cognitive deficits in the future, such as dementia and mild cognitive impairment. There was actually a study done of TCM, and it was conducted, and after it was conducted, it was concluded that TCM actually does help improve brain health, and it does reduce the risk of getting those mild cognitive impairments and other cognitive issues later on in the future, and improving quality of life for the aging population groups.
I also had disadvantages of Chinese medicine. Over the years, researchers have studied Chinese herbal products used to treat various forms of medical conditions such as mental disorders, heart disease, respiratory diseases, and stroke, but without firm conclusions. Some raise a variety of safety issues, including contamination. Some Chinese herbal products contain unspecified plant or animal material, heavy metals, drugs, or pesticides, or incorrect herbs. Lack of regulation places customers at risk of purchasing contaminated herbal products, especially products that are made overseas, those with several herbs. It is less convenient than Western medicine because you have to boil the herbs to make the medicine, and very often you have to see the Chinese doctor many times before the disease is actually cured. The herbal medicine almost always tastes very bitter, which makes it unpopular with some of the patients. Patients have to avoid eating certain food when taking the Chinese medicine, and it can also be considered to be slow in action, which may lead to a delayed proper treatment or worsening of the disease. For example, the flu virus may go to other parts of the body, causing more serious diseases or death.
Traditional Chinese medicine education to an unfamiliar patient. Traditional Chinese medicine can treat physical, spiritual, and psychological problems, which can include rheumatoid arthritis and common colds. Some various methods of Chinese medicine include herbs, acupuncture, tai chi, and cupping. If a patient wanted to purchase herbs as their method of choice, they would have to visit an herbal shop to be analyzed by a Chinese doctor. From then on, a combination of different herbs will be prescribed, and in order to consume it, it needs to be boiled together. Some risks of Chinese medicine include the risk of an allergic reaction from the herbs and also possible contamination. Make sure to ask the herbalist what is in the prescribed remedy and to do research. Although traditional Chinese medicine may work for some, it may not work for everyone. As a healthcare provider, one should inquire about the patient's view on different healthcare remedies. Allow the patient to ask questions and provide reputable information. Here is a short video presented by Professor Hannafin that describes what culturally competent healthcare is.
Hello, my name is Nancy Hannafin from the Department of Nursing here at Towson University. I'm going to talk to you today about creating culturally competent healthcare. Cultural competency requires a commitment from healthcare providers to be responsive to the different attitudes, verbal cues, and body language of the patients that they are caring for. It may not require that the healthcare provider uses the same methods of healthcare in the country of origin, but it does require that the healthcare provider has a familiarity with those countries of origin. Understanding the different cues in the healthcare settings will help to improve patients' satisfaction and healthcare outcomes. In 2001, the U.S. Office of Minority Health created the CLASS standards. CLASS stands for Culturally and Linguistically Appropriate Services. This is a series of 14 standards that are recommended guidelines to provide appropriate services for patients of all populations. When utilizing these standards, you have to remember that one size does not fit all, and you cannot stereotype any particular culture. You have to recognize and ask your patient, what is it from their culture, what part of it do they want to infuse into their health care so that you can assure them of a more satisfying patient outcome. In 2 minutes, we cannot even scratch the surface of identifying the diverse cultural needs of our patient population. But with a commitment to cultural education, we can provide a new dimension to culturally competent care and patient satisfaction.
Chinese Americans face numerous barriers accessing healthcare services that meet their cultural needs. One barrier they face in America's healthcare system is the lack of traditional Chinese medicine being implemented by providers and being covered under insurance plans. Providers may not include traditional Chinese medicine in their plan of care because they lack cultural competence to understand the cultural beliefs or practices of their patients. Chinese patients may also face racial discrimination from providers. Language barriers also make it difficult for patients and providers to exchange information or to establish a trusting relationship. So oftentimes, Chinese patients will avoid seeking professional health services and utilize more informal health services to treat their health problems. In America, the Western view of medicine may make it hard to adapt to differing views on medicine, such as the Eastern medicine practice of traditional Chinese medicine. However, nurses and healthcare providers need to acknowledge, understand, and implement the cultural practices of their patients to better manage their patients' healing and to treat their patients holistically. Culturally competent communication skills play an important role in the outcomes of their patients' health.
So we came up with 2 plans for intervention. The first one is to have training days for healthcare professionals about traditional Chinese medicine and how they can incorporate it into their care for patients who want it. So the first thing they would do during the training day would be to discuss what they already know about it and how they feel towards it. And then that way they could confront any biases or misconceptions people may have. And also, there could be videos about traditional Chinese medicine, which could include side effects, contraindications, mechanism of action. They could also make it a requirement to ask patients about their cultural practices. That way, they can accommodate them the best way possible. The other plan we came up with is patient education about the medication. So it would be the nurse's responsibility to teach the patient about the medication throughout their hospital stay and before they're discharged. It would be important to teach them about any possible implications or side effects such as headache, nausea, or diarrhea. It would also be important to mention any possible contraindications like medication and diet choices that can counteract the effectiveness of TCM, and this would prevent any rehospitalizations for the patients. To evaluate our plans, we would give out surveys to the patients and to the nurses. So for the patients, we would ask, during your visit, did any employee ask you about your cultural practices? Do you feel your healthcare providers were mindful of your culture when providing care? Rate your experience 1 to 10, 10 being the best. Do you feel confident in your knowledge about the TCM you take? Please rate 1 to 10 how well your nurse provided education about TCM, and please provide any feedback or concerns. So this survey would provide evidence about how well the healthcare professionals provided culturally competent care and how it affected the patient's experiences. For the nurses, we would ask, how comfortable do you feel in educating patients about TCM on a scale of 1 to 10, 10 being the most comfortable? Are there any cultural practices you do not feel well educated on? If so, which ones? And how would you prefer to learn about cultural practices? So this survey would provide evidence on whether or not the nurses had proper education on TCM and how comfortable they feel providing education about TCM to patients.
Overall, traditional Chinese medicine has served to be a beneficial component in protecting and advancing the health of individuals over many generations. The practice that originally started in Eastern cultures has grown popularity and become one of the preferred methods of treatment for many people worldwide, especially in the Western world. Traditional Chinese medicine provides many people with ways they can practice preventative health measures and explore different routes of healing. In relation to healthcare facilities and providers must remain unbiased in order to provide culturally sensitive quality care for all patients.